Hello, thank you for having us and for this opportunity to share the Environmental Health Research to Action project known as EHRA. I'm Karima from the University of Michigan-Dearborn, currently a senior majoring in public health and the program coordinator for EHRA Academy. Joining me in this presentation is Dr. Sampson, one of the lead researchers of the program, and she will be introducing herself later in the presentation as well. I personally came to be involved with this work out of passion for environmental science and health, and also my commitment to serve my community. So why EHRA? Our work started from the interest of the community to address air pollution issues in the city of Dearborn, specifically southeast of the city. As you can see here, this is the map of the city of Dearborn, and this portion is the southeast of Dearborn. Here is the Ford complex. So the southeast of Dearborn is physically isolated from the rest of the city by the Ford Rouge complex and other manufacturers that shape the evolution of the city's neighborhoods into spaces differentiated by class. Bordering southeast Dearborn is southwest Detroit, which is also heavily impacted by air pollution due to the presence of large industrial polluters such as Marathon Oil Refinery, among others, and also the heavy traffic activity leading to tons of diesel emissions in the area. The southeast of Dearborn has a higher rate of particulate matter, PM 2.5, pollution than 98% of the state. Also, parts of the Dearborn are located in the region that has been in known attainment for sulfur dioxide SO2 since 2010. And all of Dearborn is in known attainment for ozone, O3, since 2018. These are two criteria air pollutants under the Clean Air Act. Here is a quick overview of the here's a quick overview of the APA Clean Air Act's 6 criteria of air pollutants that are and their health effects. Respiratory-related illnesses such as asthma, COPD, are heavily impacted by diesel emissions, by ozone, by particulate matter 2.5, and also cardiovascular disease. The Southeast Dearborn community is a community with low socioeconomic status. The residents experience health disparities or disproportionate health burdens when compared to the city and the nation. As you can see here, the asthma diagnosis among adults is 14.3% in Southeast Dearborn, compared to 11.6% in Dearborn, and 8.9% in the nation. So there is a apparent health disparity in Southeast Dearborn compared to the city and to the nation. The community has a high percentage of low income and immigrant population. This is a population without a voice and little understanding of advocacy process to have an impact on the environment. It's also important to note the lack of data or studies focused on the Arab community in the U.S., as they are characterized as white in the U.S. Census. This issue excludes such a minority group from health disparity research. Also, when looking for data, we have to come up with that information and search double layered data. Also, it's important to know that in this community, the adults without health insurance is very high, which is 21.1% in Southeast Dearborn compared to 13.1% in Dearborn and 11.6% in the States. Also, very unique. This is a very unique population with 30% of the population in Southeast Durban being under the age of 18, thus making them the most vulnerable population of infants and children being exposed to air pollution and having difficult health outcome such as asthma, COPD. The EHRA is a community-based participatory research launched in 2017. They built on decades of organizing work done in Southeast Durban, especially work done by Access and Yaba. The ERA Academy, which Dr. Sampson will join me in a little bit to go in depth, has three overarching goals, which is air pollution and environmental justice 101, community science such as um, risk communication, health literacy, and collecting and presenting data. And goal number 3 is policy advocacy 101. Developing policy campaigns, role play, power mapping. Also, I want to note that the first ERA Academy was hosted in 2018 and 2019 as well. And this year, due to COVID, we did not hold a third year of ERA Academy. Thank you, and we go to Dr. Sampson from here.
As Karima mentioned, my name is Natalie Sampson, and I'm on faculty in public health at the University of Michigan-Dearborn and have been working with the EHRA steering committee for the last several years. So the youth come to the academy for 2 weeks in the summer, and it's an intensive session. We have between 20 and 25 youth, and I want to emphasize that the steering committee selects the youth that will participate, and we're interested in students who are curious about community science, about civic engagement, about policy advocacy. We're not necessarily, although some students come in with a high GPA and high test scores, that's not what we select our students on. And so priority is given to students who are experiencing environmental injustice in their own communities. Given that this is a presentation for a SIC, I want to talk a little bit about how we actually integrate the air sensors into the academy. For that session on community science, we want students to get out into the world and use these tools. And so we build off of a toolkit that came out of the University of Rochester, their NIEHS P30 Center, developing an air monitoring action plan. So we first actually have the youth in this multi-generational component work with steering committee members and community leaders to map out where they see environmental assets, environmental concerns, maybe broader than air quality, but asking them to think about air quality and air pollution issues. Look at and think about where existing air monitoring happens already because they've learned about this in the first few sessions, and then design a strategy for where we should be out there collecting more data and more information. And so we have a couple of different handheld monitors. We have some experts come in who show them how to extract the data, what the data mean, how to visualize the data, and then they're able to then go ahead and use these in presentations that they give to the community. So in the last academy, I want to emphasize that this is not just a college course using college professors, but that we actually have a list of dynamic speakers who make it incredibly interactive. The students are able to engage with environmental engineers and lawyers and elected officials and public health officials. And then after the academy, they're invited to work with a mentor to then go ahead and present their experience. And so they present data now that they know how to find this data. Some of them present data from the air monitoring process, and then they actually make a policy ask based on that policy advocacy training that they did. So we have good findings. We hear that the students like what we're doing, but also that their knowledge is increasing and that their skill set is increasing, and that we also have data we're starting to collect on alum in terms of how likely are they to participate in civic engagement activities, and more so not just going to a hearing or talking to a decision maker, but trying to navigate the complex environmental decision-making governance process and doing that in an evidence-based way, which is much more complicated. And so having collected data, having done some of the science themselves to get that perspective and understand how that fits into the policy-making process is really an important part of EHRA. So we're going to let them tell you about it.
I live in the south end of Dearborn, which is highly polluted.
The air is unclean. It smells so bad.
I ended up getting asthma.
I never realized the amount of toxins and chemicals that are going into our bodies.
They would have like a little machine and they'd put it in my mouth and it would help me breathe better.
My cousin, like 3 months ago, he died because of the asthma.
Everyone's getting affected. It's just sad.
I can't just stay and do nothing about it. All these factories just disgust me.
I'd love it if more people my age were informed of the stuff going on around them and the stuff going on in the community.
There's a lot of desensitization. People feel that, oh, well, it's foregone, there's nothing really we could do. When in reality, the time is now to stop polluting. If not now, then when?
The people who are causing the pollution don't know that it's affecting themselves too. There's no boundaries for pollution.
It kind of like hurt my heart a little bit to know that people had to fight so hard for something that you shouldn't need to have to fight for.
Can you imagine, for 40 years, we've been exposed to numerous chemicals without our knowledge?
The slag, all my life I thought that was a pile of dirt.
That's not dirt, that's slag, full of manganese. Their houses are right there.
These communities' voices are often ignored, and they're often used by big companies for their own profit and gain.
I think it's now our time to interact with our environment in a healthier, more conscientious way. I found EHRA as a way for myself to get hands-on interaction with not only seeing the environmental issues on a daily basis, but also meeting people who are on the front end of trying to solve the issues.
This academy will help spread the voice of our community to advocate our environmental issues.
If we don't try and fix it or solve the issue, it's going to get worse and it's going to affect younger generations.
I want to do something for my community, so I think by joining EHRA, I could not only help myself, but also help the community as a whole.
It's not like you can stop it, but that doesn't mean we can't at least slow it down.
So we think that EHRA has the ability to build capacity among the participants and their families, and we gain so much from working with them in this multi-generational space of longtime organizers and mentors and steering committee members and speakers. We also hope that we're able to support those working on environmental justice advocacy in this space and across the state of Michigan as the youth then go out to present what they've learned and more of their own stories. And then, of course, as Karima mentioned, there's a real lack of research on Arab communities in the United States and how environmental justice might affect them and health inequities might be playing out. And so we're hoping to influence that conversation as well. So in next steps, we are having a virtual summit later this summer. We have a lot of publications that we're trying to get out so that others can adapt and use what we've learned in terms of our curriculum. And then, our community partners are really excited about the potential of these air monitors and air sensors, and there's a lot of work happening from other local organizations, youth-based and otherwise. So we're trying to connect across these collaborations and partnerships and extend what's possible for education, for community mobilization, and then also for actually having some of that scientific data available. And then how do we help these youth get into the careers that they want to get into, whether that be law, engineering, organizing, anything that relates to these environmental justice issues. So I'll stop there. Thank you for your time, and I look forward to connecting with you all in the Q&A and beyond.